All right, so thanks for joining us today, everybody. We would just like to give the land acknowledgement. We would like to acknowledge that the land on which Surrey, British Columbia is situated is in the traditional territory of the Coast Salish peoples, including the Semiahmoo, Katzie, Coquitlam, Kwantlen, Kaikwat, and Tsawwassen First Nations. We recognize and respect the enduring presence and rich cultural heritage of these Indigenous nations. So I just want to open up a little bit about our project. So our project is called I'm Still Me, and it's funded by the Public Health Agency of Canada under the Dementia Strategic Fund awareness raising initiatives. The intention is to reduce dementia-related stigma and to encourage support communities to become more dementia inclusive. And in order to reduce stigma and create understanding, it's shown that having more knowledge about dementia is associated with less stigmatizing or negative attitudes. We hope that these 9 different topics that we are presenting in our webinars will often offer foundational knowledge and some food and thoughts. So research has shown that in order to address stigma, there's 7 things that we can do. So one of them is know the facts and educate yourself about dementia and cognitive decline, which is one of the reasons why you're here. And we're very happy that you're joining us today. Another is be aware of your attitudes and your behavior. Examine your own judgmental thinking and see what that looks like. And this is reinforced by society and upbringing within our communities. Another one is choosing your words carefully. The way that we can speak can affect the attitudes of others. Perfect example is, oh dear, you're suffering from dementia. I feel so sorry for you because you can't do the things that you used to enjoy. Try and flip that to, hello, you're a person. Oh, you have a dementia diagnosis. Look at all of the wonderful things that you're enjoying in your life and all of the things that you can and do have the capacity to do. Always try and focus on that strength based of that person. Another one is educating others. So it's passing on facts, positive attitudes, and challenging those myths and those stereotypes. Another one is to focus on the positive. So everyone has strengths. It can be kind of detrimental at times when it seems like everything's a big rain cloud, but there are positives to every little drop of gloomy rain. Support people, treat everyone with dignity and respect, and offer support and encouragement. This is community members, business leaders, care partners, persons with a dementia diagnosis, anyone. It's just always good to support everybody. And as we spoke about last week, it takes a village. Last one is include everybody. Let's try and include everybody, make everything inclusive. Try not to be exclusive as everybody is welcome. So today's topic is dementia, causes and risk factors. So we'll start out by looking at what is dementia. So dementia is a loss of memory, language, problem-solving skills, and other cognitive functions that are severe enough to affect daily functioning. They refer to this as dementia. It is not a single disease, but rather a group of symptoms that can be caused by a variety of diseases and conditions. Just some quick facts. In 2016 and 17, there were more than 432,000 individuals aged 65 years and older that were living with a diagnosed dementia in Canada. Of these individuals, 2/3 of them are women. About 9 Canadians are diagnosed with dementia every hour. And the risk of being diagnosed with dementia doubles with every 5-year increase in age between the ages of 65 and 84. So what are some things that can be done? Screening and prevention strategies. So you want to try and get early detection. So screening for dementia should begin at age 65 or earlier if you notice that there's any risk factors present. Lifestyle changes. Making healthy lifestyle changes can reduce the risk of developing dementia. Medication management. Managing medication can also help reduce the risk of developing dementia. We'll delve deeper into these as we move further along within this presentation. So what diseases cause dementia? There's risk factors such as genetics. So certain genetic mutations can increase the risk of developing dementia. Lifestyle, unhealthy lifestyle choices such as smoking, lack of exercise can also increase your risk of dementia. Environment, exposure to certain environmental toxins can also increase your excuse me, increase your risk of dementia. So although the exact cause of most dementias is not fully understood, researchers have identified these certain factors that can contribute to the development of dementia. Some of the other ones are cardiovascular disease, high blood pressure, high cholesterol, diabetes, depression, heavy alcohol consumption, and smoking. So there's some common causes of dementia. One of them is Alzheimer's disease. So this is the most common cause of dementia, and it's characterized by the presence of abnormal protein deposits in the brain. It's a progressive degenerative disorder, and it will result in the loss of memory, thinking, and language skills. The next one is vascular dementia. This can contribute to a decline in thinking skills that are caused by conditions that block or reduce blood flow to the brain, such as strokes, high blood pressure, and diabetes. The next one is Lewy body dementia. This is a type of dementia that's caused by abnormal deposits of a protein called alpha-synuclein in the brain. These abnormal protein deposits are also referred to as Lewy bodies. Next one is frontotemporal. It's a group of disorders caused by a progressive nerve cell loss in the brain's frontal lobes or the temporal lobes. So as mentioned, dementia is a complex condition with many potential causes, and it's important to understand the various causes of dementia in order to provide the best care possible for those that have been diagnosed. There's some other different types of dementia. So another one is mixed dementia. It refers to a combination of a different type of dementia. It could be Alzheimer's and vascular dementia combined. Another one is Parkinson's disease dementia. This is a progressive disorder that affects movement and can lead to a cognitive decline. Another one is called Huntington's disease. This is a hereditary disorder that causes the progressive breakdown of nerve cells in the brain. This can lead to dementia. There's an impact of some rare brain disorders and excessive alcohol consumption that can also have an effect on cognitive decline. One of them is Creutzfeldt-Jakob disease. This is a rare degenerative brain disorder that is caused by abnormal proteins in the brain called prions. Another one is normal pressure hydrocephalus. This is a condition that's characterized by the buildup of cerebral spinal fluid in the brain, which can also lead to cognitive decline. Another one is alcohol-related dementia. So this is dementia that's resulting from long-term excessive alcohol consumption and associated nutritional deficiencies that come with that. These are rare, but these neurological conditions can have a significant impact on an individual's quality of life. So it's very important to be aware of the symptoms and causes of these conditions, again, in order to seek that appropriate medical care. So some risks from dementia caused by traumatic brain injury, infectious diseases, and Down syndrome. Traumatic brain injury, so significant head injuries, especially those that have caused loss of consciousness, can increase the risk of developing dementia in later life. Infectious diseases such as HIV/AIDS, syphilis, or chronic meningitis also can lead to dementia. Down syndrome. Individuals with Down syndrome also have an increased risk of developing dementia, usually of the Alzheimer's type. These are just a few of the many factors that can increase your risk of developing dementia. Again, it's always important to be aware of these risks and take steps necessary to reduce them. Cognitive impairment, there's some other factors, causes and risk factors. One of them is medication and drug reactions. Some medications can cause interactions between multiple drugs that can cause a cognitive impairment. So that's why it's really good to get a really strong assessment of what is going on with you or a loved one or a community member, someone that you may know. Another one is nutritional deficiencies. So deficiencies in vitamins such as vitamin B12, minerals or essential fatty acids can also contribute to a cognitive decline. So it is important to note that some cases of dementia may have a combination of causes or overlapping symptoms. It does make the
diagnosis and assessment very challenging. Again, it's that really strong advocacy for yourself and for others. And it does make it challenging because additionally, not all cases of dementia are known or fully understood at this time. So sometimes it can take a very long time to kind of peel back those layers to get to the bottom of what is going on. So age, it's a primary risk factor for dementia, but genetics and lifestyle factors also play an increasing risk. So advancing age is the most significant risk factor for dementia. The risk increases significantly after the age of 65, with the incidences increasing doubly every 5 years. Age is the primary risk factor because as we reach our 70s and 80s, the likelihood of developing dementia becomes more pronounced. And it's important to understand that while dementia can affect individuals or certain age groups, the majority of dementia does occur in older adults. The aging process itself is associated with changes in the brain, making it more susceptible to various forms of cognitive decline. As we age, there may be a gradual accumulation of cellular damage, genetic and environmental factors, and other underlying conditions that contribute to the development of dementia. Well, again, it is not a normal part of aging. The risk does significantly increase with advancing age. And it's worth noting that dementia can affect individuals in their 30s, 40s, and 50s. This is known as early onset dementia. However, these cases represent a smaller proportion of overall cases, and the risk still tends to rise with age, even in these instances. As we age, our brain cells age, and their ability to communicate effectively with each other declines. The amount of gray and white matter in our brains also reduces with age, which can cause cognitive decline over time. And certain medical conditions become more prevalent as we age, and those can significantly increase the risk of dementia. These conditions include high blood pressure, high cholesterol, diabetes, and heart disease, creating a higher pooling of risk factors that escalate the onset of cognitive impairment. Lastly, our brains are exposed to toxins and wear and tear of everyday life until we reach age 65 and beyond, which can lead to cognitive decline over time. So understanding the impact of age as the primary risk factor for dementia is crucial in highlighting the need for early detection, prevention strategies, and support systems for older adults and their families. So things that increase the risk of developing dementia include, as mentioned, age. So 65 at the age of 65 and older occurs more frequently. Hypertension, this is a high blood pressure condition. This can also lead to an increase in developing dementia. Diabetes, this is caused by excessive blood sugar. You want to keep those blood sugars in control. Those also contribute to it. We'll go a little bit more further into the presentation on how those affect. A smoking habit, being overweight, being depressed, overindulging in alcohol, being physically inactive, and being socially isolated. So Alzheimer's disease causes and statistics. So as mentioned, Alzheimer's is the most common cause of dementia, and it accounts for a significant percentage of cases. The exact cause of Alzheimer's is still unclear, but researchers do believe that it combines a combination of genetics, lifestyle, and environmental factors. So when you look at the actual environmental factors, it's quite high. So that's interesting. So that's in the foods that we eat, the air that we breathe, the chemicals that we take in. And when you look at lifestyle, it's got a 20% chance there, but if you could do some lifestyle changes like quitting smoking, maybe reducing how much alcohol intake you take, adopting a healthier diet, it's amazing at how much you can reduce the risk of a dementia diagnosis. So understanding the role of genetics in Alzheimer's disease. So genetic predisposition plays a role in some of the cases of Alzheimer's disease. So mutations in those 3 genes, so the APP, PSEN1 and the PSEN2 have been identified in familial or early onset forms of Alzheimer's. So if you look at this pie chart here, where you look at the
how much of those genes are affected, and it's quite strong. But when you look at the early onset, it's quite large with the other. They don't quite know what factors that it is that's causing. These genetic mutations, though they are relatively rare, and they only account for a very small percentage of cases. So most cases of Alzheimer's disease is not directly inherited. So that brings us to lifestyle factors. So what are some things that lifestyle choices and habits can influence the risk of developing Alzheimer's disease. So several factors have been associated with a higher risk, including physical inactivity, poor diet, smoking, excessive alcohol consumption, and chronic conditions like obesity, diabetes, and hypertension. So by engaging in regular physical exercise, maintaining a healthy diet, and avoiding harmful habits may help reduce this risk. So when you look, smoking has a very high impact on the factors that can lead to Alzheimer's disease. And then the high blood pressure, high cholesterol, obesity, and diabetes are quite high as well. And these are modifiable risk factors that you can change. So some of the environmental factors that we were speaking to may also contribute to the development of Alzheimer's disease. Chronic exposure to certain toxins, pollutants, or substances, as well as head injuries, may increase the risk. Additionally, some studies suggest a possible link between cognitive decline and factors such as air pollution, education level, and occupational exposures. But again, further research is needed to establish definitive connections. So when you look here at the environmental factor, the risk of Alzheimer's disease with air pollution is quite high. So exposure to pesticides and exposures to heavy metals, the risk of Alzheimer's disease is also very high. Exposure to radiation and solvents are moderate. So it's interesting when we look over timelines, did we wear protective PPE? I remember my dad worked for the city and municipality, and, he'd be around, toxins and solvents and asbestos, and they didn't wear any PPE. So it's interesting, as we move forward in our lives, like a helmet. When I was a kid, I rode my bike everywhere, but I didn't wear a helmet. I mean, the helmet laws didn't come in until I was a teenager, but you look at these things that, can contribute to your risks, your risk factors for a cognitive decline. And I can't even think of how many times I've bonged my head outside of a tree, or I've hurt myself in a sport or something like that. So it is just very good to be mindful that there are extenuating circumstances that we may be able to put a barrier to, therefore lessen our risk. So in Alzheimer's disease, there's amyloid plaques and tau tangles that are two of the most common features. So these abnormal proteins, they build up in the brain and they lead to a decline in cognitive function. So amyloid plaques are formed by the accumulation of beta amyloid protein fragments, while tau tangles consist of tangled tau protein fibers. These abnormal proteins disrupt communication between the brain cells, which leads to their dysfunction and eventual cell death. So neuroinflammation and oxidative stress, what is their role in Alzheimer's disease? So these processes can damage neurons and trigger further inflammation, which impairs brain function and accelerates cognitive decline. So if you look at the neuroinflammation, the effect that it has is it's damaging those neurons and triggers, which further triggers inflammation. And we know that inflammation can be very detrimental on the body. So another process is that oxidative stress. This impairs brain function and it accelerates cognitive decline. And again, while the exact cause of Alzheimer's disease is still under investigation, understanding the involvement of genetic, lifestyle, and environmental factors helps provide important insights for research, prevention, and potential treatments. Gives a little bit of food for thought and makes us a little bit more mindful. So understanding the involvement of genetic, lifestyle, and environmental factors and how that comes to play in Alzheimer's disease. So as mentioned, genetics do play a role in
some cases of dementia, particularly in familial forms of Alzheimer's disease and other rare genetic conditions. These genetic factors are most commonly associated with familial forms of Alzheimer's. So it does account for a small percentage of cases. Mutations in certain genes have been identified as causative factors. Individuals who do inherit these mutations do have a significantly higher risk of developing Alzheimer's disease. These gene mutations affect the processing of the amyloid precursor protein and lead to the accumulation of beta amyloid plaques in the brain. These plaques disrupt normal cellular function, impair communication between neurons, and contribute to the neurodegenerative processes that are characteristic of Alzheimer's disease. There are other rare genetic conditions that can also lead to dementia. So for example, mutations in the MAPT gene are associated with frontotemporal dementia, which is a form of dementia that is characterized by progressive changes in behavior, personality, and language abilities. It is important to note that these genetic mutations are relatively rare, and most cases of dementia are not directly inherited. In the majority of cases, dementia is influenced by a combination of genetic, lifestyle, and environmental factors. And while genetic testing can help identify these specific gene mutations in individuals with a family history of dementia, it is not typically recommended for everyone due to its limited availability and the complex nature of genetic influences on dementia. Oh, just another look at the role of genetics in the familial risk for dementia. So as you see, the number of gene mutations for the familial risk is more common within Alzheimer's disease. And then we've got frontal temporal, which is about half of the cases of the mutations that is seen within Alzheimer's disease. Lewy body is about 3/4 of the frontal temporal, so about 1/3 of the same effect of the Alzheimer's. And then when you look at vascular dementia, it's about maybe a quarter, maybe a fifth of the Alzheimer's disease. So definitely genetics do play a role in certain cases of dementia. But with Alzheimer's disease, it definitely does have the highest number of gene mutations associated with it. So the risk of vascular dementia, vascular factors. So things such as hypertension, diabetes, high cholesterol, and smoking can definitely increase your risk of developing vascular dementia. Vascular dementia is a type of dementia that is caused by the impaired blood flow to the brain due to damage or disease affecting the blood vessels. Vascular risk factors play a crucial role to the to the development of vascular dementia, contributing to the damage of blood cells and subsequent cognitive decline. So if we look here, we've got hypertension. Hypertension is a major vascular risk factor that can lead to vascular dementia. Prolonged high blood pressure can damage the blood vessels in the brain, and it causes them to narrow. This makes them less flexible, and sometimes they can rupture. This restricts blood flow and oxygen delivery to brain cells, which then can lead to cognitive impairment. Diabetes, especially when poorly controlled, can increase the risk of developing vascular dementia. High blood sugar levels damage blood cells, leading to atherosclerosis, which is the buildup of fatty deposits in artery walls, and increases the likelihood of blood vessel blockages or mini strokes, which are known as TIAs. These disruptions in blood flow can result in a cognitive decline. Diabetes. It can also be linked to inflammation, which has been shown to accelerate brain aging, the reduction of memory, and cognitive functioning, therefore leading to an increase in developing dementia. And it can also affect other brain functions, such as learning ability and creativity, among many other ones. The way that diabetes affects the body is the high blood sugar makes the individual more prone to the buildup of plaques and tangles in the brain, which are those characteristic markers of Alzheimer's disease. And this is done from the decreased blood flow in the brain. So kind of vision it like when you have a hose and you've got a blockage in the hose, and you start building up that high tension. It has nowhere to go. It can either go back or it's going to go outward. So that's why sometimes you can get those ruptures. Diabetes also can further increase your risk of other medical conditions and risk factors, such as high blood pressure, high cholesterol levels, obesity. By controlling these risk factors, it can be very, very helpful in delaying the onset of cognitive decline. So how do you manage these blood sugars? You do it through diet, exercise, and medication. Another one is high cholesterol. So these high cholesterol levels, particularly LDL, which is your low density lipoprotein, can contribute to the development of vascular dementia. Excess LDL cholesterol can accumulate and form plaques within blood vessels, leading to atherosclerosis. These plaques can obstruct blood flow in the brain, leading to cognitive impairment. Another one is smoking. Smoking is a significant modifiable risk factor especially for vascular dementia. Evidence suggests that smoking increases the type of developing Alzheimer's disease and various types of other dementia. Cigarette smoke has harmful chemicals, including nicotine. These chemicals cause inflammation in the body, which leads to oxidative stress, which increases cell damage over time and does lead to cognitive impairment. Studies have found that the evidence of harmful chemicals to be the highest in the brain tissue of smokers, with severely intense damage in comparison to non-smokers. So furthermore, smoking can significantly narrow the brain's blood vessels, reducing blood flow to the brain, which increases the risk of stroke. And this is one of the major causes of vascular dementia. The brain requires constant access to oxygen and nutrients supplied by the blood, and if that supply is interrupted, the damage caused is irreversible. So that research shows that quitting smoking can help lower the chance of developing dementia in individuals, and it's essential to maintaining brain health and improving overall quality of life. Which leads me to my next question. Have you and your doctor ever had a conversation about risk factors of cognitive decline? It's interesting because I find it's one topic that we don't really address a lot. You know, we think, oh, I'm tired, or oh, I'm having brain fog because I've got too much on my mind, or oh, I'm stressed. When sometimes, you know, it's good to be mindful and to get that early diagnosis. So it is kind of not to add paranoia to anyone, but it is a definite kind of challenging topic to bring up. And there was just a good fact that a lot of the times there isn't a lot of time allowed within that doctor appointment to actually really get into the depths of, you know, that conversation and what those risk factors look like. That brings us to the next slide on environmental factors and its impact on dementia risk. So there are varying factors when you look at the risk level between 1 to 5. So when you look at air pollution, it sits at about a 2, water pollution sitting at about a 3, noise pollution sits at a 4. And then you got radiation exposure, which is sitting there at a 5. So those are the risk factors from the environment. So vascular risk factors and how they can increase the risk of vascular dementia. We've gone over this, but we're going to reiterate and go over it again because it is these are modifiable risk factors that we can work on to decrease our risk. And there's simple lifestyle modifications such as maintaining a healthy blood pressure, maintaining your blood sugar, your cholesterol levels, quitting smoking, and adopting a balanced diet, as well as regular exercise. These can significantly help in preventing or managing these risk factors. These are things that we can control. So high blood pressure, this is a major vascular risk factor for vascular dementia. Hypertension is a serious condition that can lead to vascular dementia, but it can be managed with lifestyle changes and medications. So hypertension, it's a condition of which the force of the blood is against the artery walls is too high. So again, think of that hose demonstration. Say there's a kink in your hose and you watch that hose and it'll start to get bigger and bigger and bigger and bigger because it's trying to go forward and it doesn't have anywhere to go. Eventually that artery wall, if it's not strong enough, then you've got all sorts of problems. Vascular dementia really is affected by the blood flow to the brain. So if you can reduce that urgency of that blood flow going to the brain, you can really reduce those vascular dementia. And it can be treatable by lifestyle changes and medication. As we said, it's one of those modifiable risk factors. So if you make those lifestyle changes and you take those medications as you're prescribed, it can help manage that hypertension and therefore reduce the risk of any complications that may come from that. So diabetes and vascular dementia. If diabetes isn't controlled, we know that it can cause it can wreak havoc on the body. So, but if it's not controlled, there's a 25% increase risk of developing vascular dementia. And if it's well controlled, then your risk goes down by 10%, or it goes down by 15%, because then well controlled only has a 10% chance of developing vascular dementia. If it can be done through exercise, diet, and managing your medications, why would you not? It's an easy fix. So the link between high cholesterol and dementia. So high cholesterol is a serious risk that can lead to the development of dementia, including Alzheimer's and vascular dementia. So it's really important to maintain healthy cholesterol levels to reduce the risk of developing not only these complications, but other complications that may develop from having high cholesterol. So when you look at this diagram here, you've got your blood vessel, you've got your little red blood cells there, and you've got this yellow material, which that's your cholesterol building up. So again, look at that hose sample and say you've got something building up within that hose. Those red blood cells aren't going to be able to get through with such ease. As you can see in that channel, only one can get through, whereas in where it's properly dilated, there's quite a few red blood cells that are able to get through. So, we know that managing cholesterol is beneficial for many health conditions, dementia being one of them. So again, smoking, going to bring up smoking again. We know that smoking is bad, but there's such a relation with smoking to vascular dementia. When you look, if you're a smoker, you have a 50% increased risk of getting vascular dementia, as opposed to you only have a 20% risk of being a non-smoker. So it's another one. It's one of those really modifiable risk factors for vascular dementia. So we know like that smoking damages blood vessels, it increases oxidative stress, it promotes inflammation, and it reduces blood flow to the body. We know inflammation can do all sorts of, can wreak havoc throughout your whole entire body, and it can be the precursor to a lot of other conditions. So by quitting smoking, it's really crucial for reducing the risk of dementia and just overall improving overall health. This includes vaping. Cigarette smoke has those harmful chemicals like the nicotine. It narrows those brain blood vessels. It reduces the blood flow to the brain, which increases your risk of stroke. And this is one of the major causes of vascular dementia, because the brain requires constant access to oxygen and nutrients that are supplied by the blood. And if that supply is interrupted, then the damage caused is irreversible. So research does show that by quitting smoking, it can help to lower the chance of developing dementia to individuals that may be affected. And it's essential to maintaining brain health and improve overall quality of life. So the impact of vascular risk factors on brain damage and cognitive impairment. So by having those vascular risk factors, it can cause a decrease in that oxygen supply to the brain, which therefore can lead to a cognitive impairment. This oxygen deprivation can damage the blood tissue and lead to those long-term cognitive declines. Again, if there's those modifiable risk factors that you can work on, please do it. If it's just something as simple as getting a little bit more exercise than you may already be getting, or adding an apple or an orange or a fresh salad to your meal each day, change
in order for it to be effective, we know it needs to be done in small incremental steps. The big thing that I was always asked before is, how do you eat an elephant? And I was like, well, I would never eat an elephant. And they were like, don't take it so literally, but it's one bite at a time. So managing vascular risk factors to reduce your risk factor of vascular dementia. So maintain that healthy blood pressure, manage blood sugar levels, control cholesterol levels, quit smoking, and adopt a balanced diet and regular exercise. So these are the things that we get told all of the time for protective factors to fight against disease. Are these main factors that also are risk factors, but these are modifiably changeable actions that you can do, because you can work at reducing your blood pressure through medication and through lifestyle factor changes. You can manage your blood sugar levels. You can control your cholesterol levels. You can work on quitting smoking, and you can adopt a balanced diet and with regular exercise. So the impact of unhealthy habits on the risk of developing dementia. So even though, we're strengths-based and we want to look at the positive of everything, let's look at the detrimental effects of having these unhealthy habits and what that looks like on the risk of developing dementia. So lifestyle factors such as physical inactivity, poor diet, obesity, excessive alcohol consumption, and smoking can greatly increase your risk of developing dementia. So physical activity, so leading a sedentary lifestyle and lack of regular exercise are associated with an increased risk of dementia. So exercise promotes the healthy blood flow to the brain, it reduces the risk of cardiovascular diseases, and it stimulates the production of brain protective substances. Engaging in regular physical activity such as walking, jogging, weight training, participating in sports, going for a walk around the block, going for a walk around the park, sitting in your chair doing one of these educational, marching on the spot, pumping your feet, anything to get that blood flow moving. Another one is unhealthy diet. So a poor diet, particularly one that is high in saturated and trans fats, refined sugars, and processed foods, is linked to an increased risk of dementia. Such diets can lead to obesity, high cholesterol, hypertension, and diabetes, all of which are risk factors for dementia. So by consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, such as those found in fish and nuts, can help promote health and reduce dementia risk. I always giggle when I see that fish is good brain food, because back when I was in high school, I was involved in a play, Rebel Without a Cause. And one of the lines that my friend had was, she played this girl that her name was Sally. And her only line in the play was, fish is brain food. So every time I hear that fish is brain food, it takes me back to all those years of where my friend had that one line. And she practiced it to death, and she executed it very well very well. So another one is obesity. Obesity in midlife has been identified as a risk factor for developing dementia in later life. Excess body weight, particularly visceral fat around the abdomen, can contribute to chronic inflammation, insulin resistance, and vascular problems, all of which increase the risk of cognitive decline. Maintaining a healthy weight through a balanced diet and regular exercise is important for reducing the risk of dementia. So the benefits of quitting smoking. Quitting smoking, if you smoke, it really does increase the risk of dementia by up to 50%. And I realize smoking is one of the hardest habits to quit. They say that it's one of the most addictive processes. I used to be a smoker. I look back now, I don't understand, how, I used to be a smoker, and I realized I have a double on the slide there. But smoking affects overall health, right? It can lead to a variety of health issues, including heart disease, stroke, and cancer. So it's not just, eliminating smoking to, reduce your risk of obtaining dementia, but it's also, it's better for your health, heart disease, stroke, and cancer. This also does involve vaping. Vaping is something that's fairly new out there, but they've been noticing that there is a lot of, it's called vaping disease, and there's a lot of lung issues that can come from it. So it's not any safer, unfortunately. So let's look at some of the benefits of what we can do. So the benefits of mental stimulation for brain health, stimulating activities such as reading, playing chess, doing puzzles can help your brain stay active and keep healthy. So a lack of mental stimulation and a sedentary lifestyle for the mind can contribute to cognitive decline. So, find that thing that you like. Is it learning a new skill? Is it socializing? Is it reading that book? Is it pursuing a new hobby? Is it going outside and going geocaching? Is it phoning up your friend and having a conversation? Is it making lists? Is it doing things that you enjoy? So the link between cognitive decline and social isolation. So social isolation and a lack of social engagement have been associated with an increased risk of cognitive decline and dementia. Maintaining social connections, participating in social activities, engaging with friends and family and the community can help protect against dementia by stimulating cognitive function and promoting emotional well-being. Question: do you participate in a healthy lifestyle? And is there anything that you are not currently doing, but plan to start doing for a healthy lifestyle? All right, so what are the things that are involved in adopting a healthy lifestyle? What do we want to do? Regular physical exercise, a balanced diet, maintaining a healthy weight, limiting alcohol consumption, quitting smoking, participating in mentally stimulating activities, and fostering life or social connections. By making positive lifestyle choices, individuals can potentially reduce the risk of developing dementia and improve overall brain health. These lifestyle factors do not only impact dementia risk, but also contribute to overall well-being and a healthier lifestyle. So cognitive reserve. Cognitive reserve is the brain's ability to withstand damage or degeneration. So facts like education, engaging in mentally stimulating activities, maintaining social connections can enhance your cognitive reserve and potentially reduce dementia risk. So cognitive reserve is the brain's ability to withstand damage and degeneration associated with aging or neurological conditions like dementia. It acts as a protective mechanism that allows individuals to maintain cognitive function despite the presence of brain pathology. In other words, cognitive reserve provides a buffer against cognitive decline. So head trauma and dementia risk. So head trauma, such as significant head injuries, particularly those that have resulted in a loss of consciousness, have been associated with an increased risk of developing dementia in later life. We were talking about sports, football players, rugby players, baseball players, and that they've noticed that there's been an increase in dementia. So this is likely due to their head trauma. How do we manage that head trauma? Let's just say that we have head trauma. I think at some point in time, not all people, but most people have suffered either a mild concussion or quite a heavy one. I got a pretty heavy one when I was a kid. I was on a tire swing and spun myself up and unwound, and I was hanging out too hard and I whacked my head against a tree, and oh my goodness, did I have a headache. I don't think I've been quite the same since. As my mom said, I knocked my marbles loose. So what does that look like for managing head trauma? So there's mechanisms of damage there. So, head trauma can cause immediate damage to the brain due to the impact, which results in physical injury, bleeding, or swelling. So there can be delayed effects caused by inflammation, disruptions in brain cell function, and the accumulation of normal proteins over time. This does lead to an increased risk of dementia. So studies have shown that there's a correlation between a history of significant head injuries and an increased risk of developing dementia. The risk appears to be more pronounced when the injury involves a loss of consciousness, such as a concussion, or a moderate to severe traumatic brain injury, which we call them TBIs. Next one is neurodegenerative processes. So head trauma can cause a cascade of neurodegenerative processes, including the accumulation of beta amyloid plaques and tau protein tangles, similar to those that are seen in Alzheimer's disease. These processes can disrupt normal brain function, impair neuronal communication, and contribute to cognitive decline. Post-traumatic dementia. So this is a specific form of dementia that can occur after a head trauma. It is characterized by cognitive impairments, behavioral changes, and memory problems that develop months or years after the injury. The exact mechanisms behind post-traumatic dementia are still being studied. So then you look at head trauma and preventative measures and management. These are appropriate. You need to have appropriate management of head injuries because it's crucial for reducing the risk of dementia. This includes promoting safety measures in various contexts, as I mentioned earlier, such as wearing protective equipment during activities with a high risk of head injury, sports, biking, construction work, bungee jumping. It's also essential to prioritize prompt and adequate medical care following head injuries to minimize damage and ensure proper management. I know that there's been a lot of people in the past, they're like, oh, I've hit my head, I'm not feeling well, I'm going to go lay down. We know that that's not the best thing to do. You want to get yourself checked out, and you also want to keep yourself awake. So then that brings us to long-term monitoring support. So individuals who have experienced significant head injuries should receive long-term monitoring and support. This may involve regular cognitive assessments, brain imaging, and close collaboration with healthcare individuals to detect any cognitive changes early on and manage them appropriately. So it's important to note that while head trauma is associated with an increased risk of dementia, it does not guarantee that an individual will develop the condition. Many people who have experienced head injuries do not develop dementia. However, it is essential to be aware of the potential risks and take preventative measures and appropriate management in the event of a head injury. So promoting safety awareness, implementing injury prevention strategies, and ensuring appropriate medical care are not only essential for reducing the risk of dementia, but also for minimizing those immediate and long-term consequences of head injuries. So other medical conditions, as we discussed, that can be associated with the risk of an increased risk of dementia, Parkinson's disease. So Parkinson's disease is a neurodegenerative disorder that primarily affects movement. However, it can also lead to cognitive changes and an increased risk to developing dementia. The cognitive impairment in Parkinson's disease often includes difficulties with memory, attention, and executive function, and visuospatial abilities. So that's somewhat like a depth perception. So the stare may not be where they are envisioning it. So these underlying mechanisms contribute to cognitive decline in Parkinson's disease. They're complex and they involve a combination of factors such as abnormal protein accumulation, neurotransmitter changes, and neuroinflammation. Down syndrome. So Down syndrome is a genetic condition that is caused by the presence of an extra copy of chromosome 21. Individuals with Down syndrome have an increased risk of developing dementia, particularly Alzheimer's disease, as they age. The overproduction of the amyloid precursor protein due to the extra chromosome 21 leads to the accumulation of beta amyloid plaques in the brain, contributing to the development of Alzheimer's disease in individuals with Down syndrome. HIV and AIDS. So this can cause a cognitive decline in the brain. HIV-associated neurocognitive disorders, called HAND, encompass a large range of cognitive changes from mild cognitive impairment to more severe forms of dementia. The virus can directly affect brain cells, causing inflammation and disrupt neural connections, resulting in cognitive decline. These medical conditions, Parkinson's, Down syndrome, and HIV/AIDS, still illustrate the diverse factors that can contribute to an increased vulnerability to cognitive decline and the development of dementia. While the specific mechanisms underlying cognitive decline in these conditions may vary, they all involve processes that impact the structure and the function of the brain. Understanding these associations are crucial for healthcare professionals to provide appropriate care,
support, and interventions to manage cognitive changes and enhance overall well-being of individuals that may be affected by these conditions. It's important for individuals with these medical conditions to receive regular medical care, including the cognitive assessments and management with the associated symptoms. Again, early detection, proactive treatment, and support systems can help mitigate the impact of cognitive decline and improve the quality of life for individuals living with these conditions. So we talked about modifiable risk factors. So there are, reducing the risk of dementia, strategies for addressing modifiable risk factors. It's important to maintain a healthy lifestyle. Manage your chronic conditions, engage in regular exercise, eat a balanced diet, and stay mentally and socially active. So healthy lifestyle, it's crucial in all areas of our life. This includes avoiding smoking, limiting your alcohol consumption, and maintaining a healthy weight. Now, I realize this is easier than done, but again, it's those small incremental steps that will help you be successful. These lifestyle choices promote overall well-being and really contribute to brain health. So managing your chronic conditions. So effectively managing your chronic conditions such as cholesterol, hypertension, diabetes, and heart disease, they can help reduce the risk of developing dementia. Regular medical checkups, adherence to prescribed medication, and lifestyle modifications recommended by healthcare professionals play a vital role in managing these conditions. Balanced diet. Consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats are essential for brain health. Certain diets, such as the Mediterranean or the DASH diet, which is dietary approaches to stop hypertension, have been associated with a reduced risk of dementia. These diets emphasize plant-based foods, lean proteins, and healthy fats like olive oils, and limited processed foods and sugars. Another one is reducing your stress levels. So try to manage your stress through relaxation techniques, mindfulness, and other methods. Sometimes it's something as simple as sitting in a quiet room and just focusing on a spot on the wall and just practicing that mindfulness. But we do understand that, reducing stress levels is easier said than done. All right. Again, managing those chronic conditions to reduce your dementia. You really want to take those proactive steps to maintain a healthy lifestyle to help prevent the onset of dementia. And if we can slow that, then that is fantastic. So physical exercise, we talked about this before, but exercise is so beneficial for so many things. So engaging in regular physical exercise is an important part of maintaining good brain health and overall well-being. So it improves cognitive function. So it helps improve memory, concentration, and decision-making skills. It can help reduce that stress and anxiety, which will lead to improved mental health. It's amazing if you're frustrated and you could take it out in your exercise. And then it's amazing at how good you feel after the fact. The hardest part of getting through exercise a lot of the time is the mind. It's not sometimes the body, it's the mind that may be your barrier. And it definitely does boost your mood, and it does help to reduce the symptoms of depression. So you just want something like an aerobic exercise, such as a brisk walking, jogging, cycling, or swimming. You want to increase that blood flow to the brain, which promotes the growth of new brain cells, and it enhances cognitive function. So you really want to aim for at least 150 minutes of moderate intensity aerobic exercise per week, along with strength training exercises. Now, that might be something as simple as picking up a can of soup and doing some bicep curls. You don't need to have expensive equipment in order to do weight training or get your heart rate up. So another question for you. Were you aware that some of the risk factors were modifiable? And also, will you be adopting healthier habits after seeing the correlations?
All right, so again, the importance of eating a balanced diet for brain health. It's essential for maintaining a healthy brain. Fruits, vegetables, whole grains, lean proteins, and healthy fats are all important components of a nutritious brain that can help your brain functioning at its best. There's all of these documentaries of, he ate McDonald's for 6 months and nothing changed within him. I question the long-term effects of that. There's something going around right now. It's called the McDonald's diet, and you can eat basically anything you want from McDonald's. You just reduce the portion size. But I question about what cholesterol levels and everything will look like after that. So benefits of mental stimulation. So engaging in mentally stimulating activity keeps your brain active, and it may reduce the risk of dementia. It's not a guaranteed, but it may reduce. And why not? So reading, puzzles, learning new skills, a new language, playing a musical instrument, engaging in intellectually challenging tasks helps stimulate the brain. The benefits of social activity for the brain. It is essential for keeping our brains healthy and active. Participating in social activities can help reduce stress, improve memory, and even increase our lifespan. So, that could be things just as interacting with others, engaging in conversations, pursuing hobbies, joining community groups. These aren't things, not everybody's a big introvert. So it might even be something, as I mentioned last week, as simple as walking around the block and being, hello, hi, how are you? Or, saying hello to all the dogs that are going by, because that's what I would do. All right, we're almost done. So the benefits of lifelong learning. Lifelong learning is an important part of maintaining cognitive health. Acquiring new knowledge can stimulate the brain, and so consider taking courses, attending a lecture, attending an education session such as this, engaging in online resources to challenge your mind and really promote that brain plasticity. By promoting a healthy lifestyle, managing chronic conditions, engaging in regular exercise, eating a balanced diet, staying mentally and socially active, individuals can potentially reduce the risk of developing dementia and promote overall brain health. So it's important to note that these strategies are beneficial for individuals of all ages and should be integrated into daily routines for long-term brain health. It's never too early to start working on your brain health. Consistency and commitment to these habits contribute to maintaining cognitive function and reducing the risk of dementia. So that brings us to our resources. So if you want to delve a little bit deeper into the research that was done to accumulate this information, then please do check them out. All of the sources are cited there. Okay, so we'll just open up with a quick little quiz just to kind of reinforce learning. It's very simplistic. So we'll just do a little bit of a recap of causes and factors of dementia. True or false? Age is a significant risk factor in developing dementia. Yes, advanced age is a primary risk factor for dementia, with the risk of increasing significantly after the age of 65. Which of the following medical conditions is known to increase the risk of vascular dementia? Okay, so this is a multiple choice question. Is it A, high blood pressure, B, diabetes, C, obesity, or D, all of the above? It is all of the above. So medical conditions like high blood pressure, diabetes, and obesity can increase the risk of vascular dementia. Next question, true or false? Oop, got a little bit of a typo in there. Genetics play a role in determining the risk of developing dementia. True or false? Genetics can influence an individual's susceptibility to certain types of dementia, such as familial Alzheimer's disease, as we learned. All right, next question. Which lifestyle factor has been linked to a reduced risk of developing dementia? Is it A, eating ice cream? Is it B, watching TV? Or is it C, physical activity? So again, which lifestyle factor has been linked to a reduced risk of developing dementia? Is it the eating the ice cream, the watching the TV, or the physical activity?
So regular exercise has been associated with lowering your risk of developing dementia. So many benefits to that exercise. We're meant to move. All right, what is the primary cause of Alzheimer's disease? The most common type of dementia. What is the primary cause? All right, what is the primary cause? A little bit of a trick question here. The exact cause is unknown, but it is believed to involve a combination of genetic, lifestyle, and environmental factors. So there isn't one exact cause that they've yet figured out. Hopefully within our lifetime, we will have at least some greater treatments and some greater cures. Though I did stumble across an article yesterday about how they have new medication out and they did a trial on it, and there has been no decline in any memory in these individuals that piloted it for 1 year. All right, next question, true or false? There are dementia risk factors that are modifiable. You betcha, that answer is true. There are many lifestyle changes that you can make to contribute to lessening your dementia risk factors. Next question, true or false? Head injuries increase the risk of developing dementia. Yes, repeated head injuries such as those sustained by athletes, shoulder or soldiers having been linked to increased developing of dementia. I don't know where all these N's came from. All right, what type of head injury is associated with an increased risk of developing dementia in later life? We talked about this with athletes, and I gave you a shortened acronym as to what we refer to it. It's 3 letters. So yes, so a traumatic brain injury, also known as a TBI. So a history of moderate to severe TBI has been linked to a higher risk of dementia in later life. Next question, true or false? Smoking has been linked to an increased risk of developing dementia. And it's true, smoking is considered a modifiable risk factor for dementia, as it's been associated with an increased risk of risk factor, for dementia. 2 more questions to go. Which substance abuse disorder has been linked to an increased risk of developing dementia? There's a little bit of a hint there for you in the picture. So yes, it's alcohol abuse. So chronic heavy alcohol consumption has been associated with an increased risk of dementia. All right, last question here, everyone. True or false? Dementia is caused by a single factor. That answer is false. Dementia is caused by a combination of factors, including genetics, lifestyle, and environmental factors. All right, I'm going to stop sharing my screen here. Thanks for joining me. Bye.